Posterior polar cataracts are challenging because they are associated with a significantly higher risk of posterior capsular rupture, up to 36%. When performing surgery in these cases, our primary goal is to minimize the risk of this specific complication. The reason these cases are so volatile is that the cataract often involves the posterior part of the capsular bag itself. In some instances, there is already an underlying communication between the anterior and posterior chambers. If we perform a standard hydrodissection, the fluid pressure can travel through this opening, forcing a posterior capsular rupture and ultimately causing the nucleus to luxate into the vitreous. To prevent this, we must avoid hydrodissection entirely. Instead, we perform a hydro-delamination of the nucleus. As you can see in this example, we simply embed the cannula into the lens material just outside the nucleus. This allows us to delaminate the nucleus from the rest of the lens without forcing fluid toward a potentially compromised posterior capsule. When it comes time to remove the lens, it is vital to use low vacuum settings. This reduces the risk of pulling on the posterior part of the lens until the final stages of the surgery. As you see here, it is much safer to remove the remaining polar material using the I/A handpiece toward the end of the case. In many cases, you will find cortical matter still attached to the posterior capsule. This can be safely polished with the I/A, allowing us to successfully finish the case without causing a rupture, as demonstrated in this successful outcome.